middle pages. My name is Grace Hussein. I'm glad to be here, and I'm glad you're there for us. Yes, this morning we are here to do the best we can to improve the living standard of people through information. And this morning I know that so many of us know a part of the goals of the sustainable development. That's the sustainable development goals, and I think I can just remember that there is need for no poverty, and hunger, and quality education, and then there's also need for good health and well-being. And to achieve this will be near impossible if the quality of health, or there's no fear and all that. So thank you so much for coming around. We hope that your coming here will benefit a lot of people. So let's go straight to our discuss today. This morning we are talking on family planning and safe motherhood practice in Akwa Ibom State. And I'd like us to establish what family planning is and safe motherhood, so that it will help us to really explore it. So start with explaining to us what family planning is.
Thank you so much. I would like to start with the safe motherhood.
Okay.
Because just as the name, safe motherhood, what is actually motherhood? It has to do with it speaks about mother and how to care. A mother that gives birth to a child and cares for the child, that is motherhood. And safe motherhood speaks about all the processes to make sure that there is no casualty that will lead to the life to losing the life of the mother or the life of the child. In a simple terms or definition, that is what safe motherhood is all about. And talking about family planning is motherhood. And when we are talking about family planning, a family, we know what a family is: a father, a mother, and of course the children.
Okay.
So planning your family so that that family will be safe. If we want to relate it to safe motherhood, a woman will be impregnated by a man to give birth to a child, and this child will be nurtured. So family planning is about girl should abstain from sex. But I want to tell us that there are some young girls that their drives is so high that they cannot abstain from sexual intercourse. And if you know that you cannot abstain from it, you need the knowledge of what to do, so that you prevent unwanted pregnancy. Let me put it like that. It's also transmitted through sexual intercourse. So if you explore that method, you also prevent yourself from being infected.
Okay, let's talk about spacing. Spacing for especially husband and wife, they have, you say we should prevent unwanted pregnancy. What about that the case of spacing the children? If I want maybe 5 children, how does family planning help me to achieve that, and then still have the necessary maybe good health? And then
I think it's a change of the exchange of words, use of words. Some people will speak about child spacing.
Okay.
Mostly because of their religious belief, they don't want to hear family planning, but they can listen to child spacing. I said it that planning your family, you plan it in such a way that you get pregnant when you are ready. So assuming you have to bring yourself together health-wise, able to get more resources that you'll be able to use, to take care of the little ones that you earlier have. And also, in our society, we see a man as the one that provides, that gives to the wife. So you also give allowance to your husband to be able to Nancy or baby, so that there will be no crisis, so that you not crash.
And so that you'll be able to train them also?
Yes, you'll be able to train them well.
Okay.
Yes.
So
the data that we have gotten from facilities, we can say that we are only able to achieve between 80 to 20% uptake of family planning in the states, and we are still
what
18 to 20%.
Okay.
Yes, uptake.
Okay.
While we are hoping that in due course we are seeking to see whether we can attain 30%.
Okay.
And I want to tell us that access to family planning, we see it in as
a public service, health care service. Do you think that the level of awareness on issues around family, reproductive health, family planning, and even this safe motherhood that we are talking about is widely spread? Do women even know and understand it? The level of awareness created is enough to achieve that?
I cannot say that is enough, but I know that there is awareness creation. And permit me to mention that the awareness creation equally needs support and collaboration. Why am I saying that? Most of the activities that leads to awareness towards family planning in this state is done by partners, non-governmental organizations that have come to partner with the states. And you know they
like
cannot.
Which one?
Like the Challenge Initiative.
Okay.
They are the core NGO that is in Akwa Ibom State is in trouble. If we are talking about reduction in maternal mortality and even morbidity, then we have to focus on how to fund family planning units. In what aspect? In supply of commodities, most especially. Because you know,
yes, because you keep saying family planning is free, but some women complain that there is something that they pay. So let's establish what is that.
Thank you so much. Family planning should be free, but the question is it absolutely free? I will tell you here, no, it's not. And the question is why? Trying to find out why it is not free, the health providers will complain of lack of commodities, lack of consumables, most especially.
Please, can you explain what commodities and what consumables?
Commodities are those commodities are like the pills,
okay,
like the implants, those things,
okay,
that is used.
Methods.
Yes, yes.
Okay.
In implementing the method. But consumables are things like cotton wool,
okay, gloves,
disinfectants,
okay,
gloves,
okay,
you know. Sometimes they do have, sometimes mostly from partners that have come in to support family planning, and a little from the state. But it's not enough. That is why we are advocating that government should look into supply of commodities, enough commodities to be able, because when you say family planning is free and a woman will leave her community to the clinic and take ownership and responsibility of her health and the health of her community, and family planning is the key. I can say that.
So consumables, most of these especially the primary health care facilities,
Yeah.
many times also sometimes the women go there and they say they are asked to pay 100 naira or so, and some of them don't have, and now you are advocating. Where are you
to speak on family planning, to create awareness on the same thing that we are talking about, and other
just like you have come in?
Yes, okay. Other media houses like the Passion FM. So we actually advocated to them that they should help us, you know, to include awareness on family planning in their own programs and activity. And of course, we are making effort to meet with the wife of the governor and the city governor, Akwa Ibom.
Thank God they're not recruiting, or what's the problem, please? Do you know?
Yes, I feel.
Okay.
Let me not say I know.
Okay.
But I feel that enough. and they also have to look at what we call, they have to plan well, because if you resource management, we have to look into human resource management in our ministries and other parastatals, because if you have a good human resource management sector, you'll be able to project, you'll be able to know the number of persons that will retire in a certain year and plan towards recruiting more.
Okay.
So they are not recruiting enough, and even the little they recruited, there is a gap because of
urban. Some people are in the urban.
No, it's not that.
Okay.
Because of migrating.
Okay.
Because of migrating to other countries where services, where they are well paid. So we have to, the government have to do things, that will keep the health workers working.
Okay.
Things that the economy is biting so much that everyone is looking for a greener pasture. So in as much as you recruit, you also develop a system to keep and sustain. I want to tell you that in most of our primary health care facilities, the staff working there is grossly inadequate. Even when the what do they call it? Tax shifting. There's something they call tax shifting. There was something that came in which lower level health workers were trained to handle take up, but the situation is not still addressed. So we really need to close that gap, because I know they are on top of capacity building of staff in the health facilities on family planning.
They go to those hospitals and train them on what do they do?
Well, they go there for in-house training, and they also invite them out.
Okay.
But within the state, to train them on how to be family planning providers. They even raise what they call coaches. They train people to be coaches, to go to the facilities and coach other facility staff on how to do family planning services.
And for how long are they going to do that? Do you know?
They've been on, but they cannot stay forever.
So you think that there will be a time they will withdraw the
services? Yes, they will withdraw.
What will happen if they withdraw?
That is what we are advocating for. We are advocating that these partners will not stay here with us for life. Yes. So we have to be on our own. They have shown us the way. They have come to help. We have to also look for a way to generate resources to help us to be on our own, to close these gaps.
So does it mean that, from what you're saying, it means that achieving safe motherhood is not really attainable in Akwa Ibom State if we go by the level of facilities and even the personnel you're talking about? Or is it possible to achieve safe motherhood even up to, say, about 70%?
Not immediately.
Okay.
We are hoping.
Okay.
We are hoping.
And how will we achieve it?
We will achieve it when the gaps of gross inadequate facility staff, health facilities is being health facility
health
staff.
Personnel.
Yes,
Okay.
is being
addressed.
When more resources or funding is being allocated, not generally, I'm not talking about health sector in general, to family planning,
Okay. Okay.
to reproductive health,
Okay.
so that we can address or tackle those challenges that we see that can hinder us from achieving safe motherhood.
Okay. Let's talk a little about the attitude of pregnant women toward health facility delivery by skilled birth attendant. I think you started it and I caught you halfway. So let's take a look at that as it relates to safe motherhood.
in our state, we are talking about Akwa Ibom State.
Yes, yes.
I started by saying that the uptake is between 18 to 20%, and that is low.
Quite low.
That is quite low. The attitude of women and pregnant women precisely is not impressive, because I will tell you that the attendance, the uptake in antenatal clinic is so much in many of the health facilities, but when you look at records of delivery, if you know labor most at times happens at night, they may not have the means to transport themselves to the hospital. Maybe lack of money. We're talking about socioeconomic status can hinder them. Maybe nobody to support them to take them to the facility, and they turn back to help themselves with what is available around them. And it could also be attitude of health workers.
I was about asking you that.
You know, we are, you know, nurses, they are human beings, but there are ones that cannot control their attitude. They cannot manage when they are on duty. They cannot suppress that attitude which should not be up while they are saving. And you know, you will hear some of the clients saying, rather than going to that clinic to give birth, let me die.
God forbid.
What a health staff, what a nurse, because everybody serving in the facility, whether it's a cleaner or a community health, a rural woman knows that you are a nurse. What that nurse did to me, I can never forget. So if there is a system in place to check all this and report and for actions to be taken, I think that one can be solved.
So,
yeah.
wow, it still takes us back to looking at modalities to solve this problem of personnel, and even the facilities are good now. So I think we should dwell more on improving.
The local government, they don't have the understanding of what is expected at the primary healthcare level. They feel that if they supply cards, registration cards to the health facilities, those cards must be sold to generate revenue for the local government council. So assuming a pregnant woman, she doesn't have money to even go and register herself. What am I saying? That antenatal clinic registration is not free in most of our health facilities at the local government, because they have to pay for antenatal card to be registered before they are taken care of. So if that is not done, we are repeating the cycle again. That woman will stay away from attending antenatal clinic. And what happens in the antenatal clinic? Assessments, a physical assessment of that woman to prepare her for a safe delivery. Even after delivery, we are talking about postnatal care. She has to go back for checkup. Some of them cannot go because some of the times commodities, drugs, treatments may not be actually free, absolutely free. They have to pay for treatment, and if they don't have money, they will not want to go to the clinic. Maybe they are visited once and they couldn't pay for the services, and they get back home and retire to their fate of patronizing TBS and vendors in their various communities. So safe motherhood, we cannot really have safe motherhood if all these challenges and hindrances are not addressed properly.
Okay. Yes, as a woman, you are one, in fact, number one, a woman before you become whatever you were in the public health facilities where you worked before. Do you think that those paying for those commodities and maybe paying few things to access those services is enough for a woman to put her life at risk? Do you think that where they go to assess the like the traditional birth attendant, where they go there for delivery, do you think that it is absolutely I'm not advocating, I just want to find out, do you think that that's enough for a woman to prefer to die? Let me put it that way.
It's not enough. You think they don't love themselves? They love themselves. But I want to tell you that the belief system of a human being has a lot to play in somebody's livelihood. You have a TBA in your community that has agreement with you. You are pregnant, you don't have money now. You can come to my place, I'll take care of you after you pay me the money. Can that be done?
Can even lease land.
Yes. Can that be done?
Land. Okay.
Can that be done in a government facility? It cannot be done. So sometimes that is the only option that is left for them to utilize. I spoke about the religious belief interference too. Some of them, they could have what it takes to access facilities, but because of their belief system, their religious belief, okay, like the Faith Tabernacle sect, they don't believe in accessing hospitals to go and have delivery.
Well, I don't know about that, but I think I know that there are some people who don't believe on CS. Umanikwa, that's what we call it.
There are some sects that don't believe in assisted delivery, so they don't go to the hospital for assisted delivery. They believe in delivering on their own. Yes.
Okay. So before we go, talking about safe motherhood, it has to do with the mother being safe in all aspects.
Yeah.
And this has to do with reproductive health. And today we have established so many things, and I believe that at the end of the day, something should be done in this direction. If not, we may still be going around the circle. Now, the women need to understand, when they go for antenatal, these are the things that they benefit from, or maybe these are information they are able to get from there, and this can help them. Can you reiterate some of those things? Maybe that my sister may not have known. Maybe they may not know how to achieve safe motherhood. I think you have so much to say on that. So can you please? Yes, in case you're just joining us, this is AKBC and Heartbeat. We are discussing family planning and safe motherhood practice in Akwa Ibom State. I want to believe that you are taking a thing or two from us, and you are going to run with the information that you're having from here. We are advocating safe motherhood, but family planning can be of good health. So let's just hear from you.
It is important for a woman to access health facility for care during pregnancy, during childbearing, and even after childbearing. Starting from antenatal, that is when a woman is pregnant. When you are pregnant and you access a facility, your history, your medical history, and other physical examination will be carried out on you to know the state of your pregnancy, starting from confirming if you are even pregnant. Because some women may assume they are pregnant, but by the time they access antenatal clinic and it is confirmed that they are not pregnant. So when a woman access antenatal clinic, all those tests and examination will be done to prepare her for delivery. During the session of antenatal clinic, there will be a session for health talk. There will be a session for counseling to discover so many things about you as a person, mostly know your medical history, so that preventive measures could be put in place to achieve a safe delivery when there is time. There could be tests. Several tests will be carried out to prevent so many occurrences. You know, there's a case of eclampsia where a woman fits when he wants to go and give birth, that could be checked during antenatal clinic. That could be checked, so that that woman will not have issues. What about when a woman goes, okay, even test for HIV/AIDS, so that the unborn child will be safe, so that the mother will be healthy? All those things will be put in place, and a woman will be advised on how to prepare for delivery, things that she has to do to remain healthy, and so that the baby in her womb will also be healthy, and to prevent most of the what we call abnormalities, congenital what some children are born with all sort of abnormalities, so that could be checked during antenatal. What happens during labor when you go to delivery? If you don't take time, if you don't deliver in the facility and hygienic in an hygienic environment, you can expose yourself to infection, and that will affect you. So it's really important that you access that, and even after birth you have to go back for reassessment, so that you can go back a healthy and productive mother.
If I allow you to go on, you can take the whole day.
Thank you so much.
But I'd like you to just give us a parting shot as it has to do with family planning and safe motherhood as we live.
Thank you so much for the opportunity given me to be in the studio today to speak to Akwa Ibomites. I want to encourage us as women, as mothers, to access family planning, because that is the key to a safe motherhood. That is the key to a good reproductive health. So thank you so much for the time that you have given me today, and I believe that what a little I've been able to put across today will help us to have